Welcome to this short training on bloodborne infectious diseases for healthcare workers. In your work, you may be exposed to bloodborne pathogens, germs carried in blood and certain body fluids that can cause serious disease. The ones we focus on are hepatitis B virus, hepatitis C virus, and human immunodeficiency virus, or HIV. This module will cover how exposures happen, what to do immediately after an exposure, key post-exposure follow-up steps, and how to prevent injuries and infections in your everyday practice. First, let's review how exposures happen. The highest risk events are percutaneous injuries, such as needle sticks or cuts from contaminated sharps like scalpels or broken ampules. Splashes of blood or other potentially infectious body fluids to your eyes, nose, mouth, or non-intact skin can also transmit infection. Risk fluids include blood, body fluids visibly contaminated with blood, and other potentially infectious materials, such as semen, vaginal secretions, and many internal body fluids. Intact skin contact with small amounts of blood is much lower risk, but good hygiene and prompt washing are still essential. If you experience a possible exposure, act immediately. For needle sticks or cuts, wash the area right away with soap and water. Do not squeeze the wound. For splashes to your nose, mouth, or skin, flush thoroughly with water. For your eyes, irrigate with clean water, saline, or sterile eye solution. As soon as the area is rinsed, report the incident to your supervisor and occupational health so they can assess your risk, arrange testing, and decide whether post-exposure prophylaxis or PEP is indicated. For hepatitis B, timely post-exposure prophylaxis is crucial. Depending on your vaccination and antibody status, you may need hepatitis B immune globulin, additional vaccine doses, or both, ideally within 24 hours. For hepatitis C, routine prophylactic medication is not recommended. Instead, exposed workers need baseline and follow-up testing to detect infection early. For HIV, start post-exposure prophylaxis medicines as soon as possible, within hours, not days after a significant exposure, and continue the full course if tolerated. Always follow your facility's protocol and consult expert resources when needed. Prevention starts with consistent reporting of all blood and body fluid exposures, so hazards can be identified and corrected. Facilities should use the hierarchy of controls. Eliminate or substitute devices that cause injuries when possible. Use engineering controls such as sharps-free systems, safety-engineered needles, and puncture-resistant sharps containers. And support safe work practices through clear policies and training. Personal protective equipment, gloves, gowns, eye and face protection, and respirators when indicated adds an important last layer of defense. Know your local post-exposure contacts and keep emergency numbers readily available.